Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Brian Whorley. He's a healthcare executive, and today we're going to talk about how the Medicare prescription payment plan provides a practical solution to medication non-adherence. Brian, welcome to the show.
Thank you so much for having me on, Kevin.
All right, so let's start by briefly sharing your story and journey.
I love healthcare. I've worked in it since 2007. Got my start at a 400-bed community hospital based here in Columbia, Missouri, Boone Hospital Center. I absolutely loved working in healthcare and being part of the mission to help people in our community better access and take access care. I founded Patient in April 2018 to help people better access and afford healthcare nationally.
Excellent. And today we're going to talk about the Medicare prescription payment plan. Before getting to your article, let's make sure we're all on the same page. What exactly is that?
The Medicare prescription payment plan came into law in August of 2022 as part of the Inflation Reduction Act. What the design of it is to help seniors, help Medicare beneficiaries access and better afford out-of-pocket pharmaceutical expenses. So my mom is part of this plan. She can opt in to the Medicare prescription payment plan. It's free for her to call her insurer. Every single Part D plan must offer this to their members. What it does is she'll be able to walk in to her local pharmacy. They'll run her insurance card. They'll see that she's opted into the Medicare prescription payment plan. Her insurer will pay her copay on her behalf time of service. So my mom's able to walk in, get her prescription, walk out the door. No money changes hand at time of service. Her party plan is essentially fronting her out-of-pocket responsibility at time of service. She goes around, gets care all through the month. At the end of the month, she receives a simple statement from her insurer showing where she's gone for care, how much care she's gotten. And then it'll say, hey, gosh, we've already paid the pharmacies X dollars on your behalf. And then my mom will have opportunity to review those payments. And then she can either pay that in full, like she does her Amex or something else, or she can pay that over time, over out to the whole plan year without any interest or fees. So the idea is, hey, gosh, how do we help seniors how do we lower the bar in terms of cost being a barrier to care? If we're unable to change the price of care, the Medicare prescription payment plan uh, is sort of intent on improving the ability of people to pay that price at the counter and just give people time, Kevin, give people time and use time in order to expand affordability. More people can afford $10 a month over 10 months than can afford $100 at a point of service. And so the intention here is to use time in order to sort of lower that bar, not remove responsibility from the equation, but to lower that bar and to make it easier to pay for care.
And just before moving on, are we talking about traditional Medicare or are we talking about Medicare Advantage plans, or does this apply to both scenarios?
It applies to both. Yeah, so it applies to both. So concepted and in law August 22, it is now live nationally. So every single Medicare beneficiary who has Part D coverage, this is now a feature of their plan. So they have to tell their insurer to turn this on. Hey, I want to opt into this. But when they do so, they're able to walk in, get care, walk out with their prescription. Pharmacy is paid in full for that full copay by their insurer. And essentially, what the sort of net result here is going to ideally be, making care a little bit more accessible, affordable, and I think in a sense, equitable. It's sort of a practical consideration of the ability to pay the price. So yeah, all 54, million Americans or 56 million Americans with Part D coverage, this is now a required component
Hmm.
of their health plan. And so it's something that my company had already been doing for years outside of Medicare commercially, but this is really that practice is standardized nationally now.
All right. So you framed this as a solution to help with medication non-adherence. So talk about your
Correct.
article and talk about how costs acts as a barrier to medication adherence in the first place. How does cost act as a barrier?
Yeah, if there is credible evidence of liquidity sensitivity in healthcare, the idea that member cost share has an effect on consumption. And so this idea that member cost share, it's always going to be in place as a part of good plan design.
Hmm.
And it's essentially a pragmatic approach to say, how do we ensure with an E that a $10 copay, a $20 copay, a $60 copay, a $600 amount isn't going to stand in the way or cause someone not being able to pick up that prescription. There's a great study written on this in 2020. It's the liquidity sensitivity in healthcare. Three authors wrote it. Within that, they talked about in 2018, a third of Americans, skip picking up a script due to cost-related adherence. The sort of idea of businesses like GoodRx and others is just sort of this concept that the price we pay matters,
Hmm.
and our ability to pay that price matters. And so, rather than sort of wishing or wanting a world where that price is $0 for everyone all the time, it's sort of a recognition of there will be a price to pay, but we have to ensure the ability of people to pay that price and to more effortlessly um, ensure that everyone, whatever's in their wallet today, can still pick up that prescription.
So give us a practical example of this prescription plan in action. Let's say someone goes to the pharmacy to pick up a medication and say it costs $1,000. So if
Yeah.
someone opted into a Medicare prescription plan, give us an example of that $1,000 being spread out over time.
Yeah. So let's use my mom. She opts in. She tells her insurer, "Hey, I want to turn this on." She can do that via, online, phone, email, whatever. She walks in. She's going to present her insurance card. The pharmacy is going to run that insurance card. In this instance, $1,000. CMS has identified a likely to benefit of $600 or more. I think in a practical sense, like even a $60 script is could be a barrier, but so today, the way that law's written today, a $600 script causes the pharmacy management system to actually throw up
Hmm.
a flag and where the pharmacist has said, hey, this is a person who is likely to benefit from the Medicare prescription payment plan.
Hmm.
It will print out a likely to benefit sort of notice. The pharmacist, pharm tech, pharmacy, they have a requirement now for medications over 600 to inform the patient that, hey, you're likely to benefit of this. This is thing in case my mom hadn't heard about it. And then they would actually run like a secondary bin, PCN, and actually charge that 600 instead of collecting it from my mom there at
Hmm.
point of service. They would essentially charge that to her insurer. Insurer pays the pharmacy, so the pharmacy has certainty of payment of that.
Hmm.
My mom walks out the door with her prescription, and then at the end of the month, that the insurer essentially is running software like ours under the hood that is comparing to a CMS driven table. That CMS driven table says, hey, for folks who opt
Hmm.
in these months early in the year, divide that 1,000 over the course of the plan year in this manner, and it essentially gives her the payments that she has to make throughout the course of the year. Always no interest, no fees of any kind. It's just simply that $1,000 divided out.
Hmm.
It's not a clean, even division, but it is, spread through the course of the year, through the plan year. And my mom can either pay that in full at the end of the month, just like she does every other bill that she receives. Or if she wants to hang on to her money a little longer, she can just make those payments as prescribed on the statement.
And like you said, there's no fees, there's no interest
Correct.
equivalent charges. It's basically that price spread out over a period of time. And the end number that they end up paying would be the same as if they paid it up front.
That's absolutely right. The spread is a little wonky. It's a little uneven. It's just the way that the laws is written. We've developed, a calcul. There are calculators out there on different insurers' websites, but it is spread out through the course of the year. That's right. So folks who opted in during the open enrollment session, like the most that they would pay in a month over the plan year is like $167, which is great. So that the $2,000 that's part of 2025, the Part D, the new out-of-pocket max is 2,000. So take 2,000 divided by 12 over the course. That's the maximum that they could pay in that time. If they enroll later in the year, then it changes the equation. And so, like, Kevin, there are aspects of this to be improved and iterate on over the years, but out of the gate today, 54 million Americans now have the ability to have their insurer essentially front that money. Like my mom can leave her purse at home, walk in, pick up her prescriptions, walk out. If I'm a provider, which I am not, but if I'm a physician, I now at least know, right? Like that there is this, universal plan that everyone on Medicare has, where whatever I tell them that medication that we would like them on or prefer them to be on, they have another way to pay. They have an augmentation for their ability to pay that.
Now, when you talk to Medicare beneficiaries, is this a relatively well-known feature? Is this something that they're surprised on hearing this a feature? So, in general, how well known is this among beneficiaries?
It is a brand new program. So I wouldn't be surprised if 99% of your listeners on this podcast, if this is the first time they're hearing about it. Certainly, CMS has put out education about this. The insurers must notify plan members in 2024 prospectively of identify people with high spend who are likely to benefit. Those folks received letters in the mail during the fall when people present at pharmacies and the medication is $600 and up. The pharmacy is now will be telling folks about this. I think on a practical basis, more folks could benefit from this, like below the $600. Sort of the common idea is like, gosh, if a copay is $150 at a pharmacy, a lot of pharmacies will call in advance and ensure that the patient is able to pay before they even order that medication if they needed to order in, because they don't want to be stuck with a medication that someone can't purchase or return as a stock in an expensive way. So the universe of who can benefit from this is the full universe. But this is a new program. It's going to take some time for folks to realize it, but they will realize that the net result of this will be more folks are able to take the medication that you would prefer them to be on. This is going to lower that cost at the point of service as a barrier to care without, importantly, removing responsibility from the equation. We're just giving people a easier way to manage that responsibility, which I think that's a step in the right direction. I think that's a step toward more adherence, and it's a pragmatic sort of purple idea.
What are some ways physicians like myself can facilitate and inform patients to potentially consider the Medicare prescription payment plan?
I think, yeah, gosh, there has to be a moment where if someone is in your office and you really would think that this is the right medication or treatment for them, and you hear that sigh or see the look in their face, and that's a bridge too far. This brings that bridge a little closer. It's free to them. This is an expansion of Medicare benefit. They don't pay a penny more, right? This gives folks who maybe previously, gosh, I'm not going to go pick that up, or I'm going to break this pill in half, and gosh, it's a time release medication, so it's not even doing it. It doesn't have the same efficacy of that. Like, this is ensuring that more people are going to be better able to pick up that prescription to take their medicine that you would like them to take in order to get the outcomes that you would want. And so I think folks just being aware of it is an important part, helping to inform or educate their patients that this is now an option. I think over the years to come, Kevin, I think that this expands into the commercial world as well. I think employers follow this lead. I think this merges into the the medical side as well. But today, the 50 plus million Americans with Part D coverage have this available to them, and they got to navigate their plans, websites, and whatnot in order to turn this on or opt in. But once they notify an insurer today, as of 2025, they have 24 hours to opt them in. And so, if someone's sitting in your office today, inform them of that, have them call that number on the back of the card, and tomorrow they could, pick up that prescription, $0 at the counter. They still owe the money. It's not free, right? This doesn't turn it into a free program, but at the end of the month, they'll get a nice clean statement.
Mm-hmm.
They can pay it in full, or again, pay as prescribed over the entire year and just smooth that out. And ideally, it's less often that folks are like representing because a small problem has become a medium or become a large problem due to non-adherence. Every physician must have seen something like that, and this is just a pragmatic sort of approach to address what was previously a problem that's frankly out of their reach, right? Like the out of pocket sort of out of reach.
Yeah.
This is something that is designed to enhance that.
We're talking to Brian Whorley. He's a healthcare executive. Today's Kevin MD article is How the Medicare Prescription Payment Plan Provides a Practical Solution to Medication Non-Adherence. Brian, let's end with some take-home messages they want to leave with the Kevin MD audience.
Every single person should consider the Medicare prescription payment plan. Beneficiaries can opt in today and anytime in 2025 in order to better access and afford health care.
Brian, thank you so much for sharing your perspective and insight. And thanks again for coming on the show.
Thank you, Kevin.